In 2023, the World Health Organization declared that no amount of alcohol is safe. The statement made headlines globally and reinforced a growing narrative that any wine, even a single glass with dinner, represents a meaningful health threat. This framing has become increasingly common in health reporting, and many people now approach a glass of wine with the kind of anxiety previously reserved for obviously risky behaviors. The science behind alcohol and health is real and should not be dismissed. Wine and all alcohol carry genuine health risks that increase with intake. But there is a specific problem with how those risks are communicated that creates a distorted picture. And that distortion matters because it allows people to feel virtuous about daily habits that carry demonstrably larger health risks than a moderate glass of wine. Understanding the distinction between relative risk and absolute risk is essential to evaluating health claims about wine and about many other things. Here is how relative risk inflation works, because it is the mechanism behind most alarming health statistics you read, and it applies far beyond alcohol. Imagine a study finding that regular moderate drinkers have a 10% higher risk of esophageal cancer than non-drinkers. That 10% sounds alarming. A journalist writes the headline, "Alcohol raises cancer risk by 10%. Readers reasonably interpret this as a substantial increase in a dangerous disease. But look at the absolute numbers. If the baseline lifetime risk of esophageal cancer in non-drinkers is 1.3%, a 10% increase brings that to 1.43% for moderate drinkers. Both statements, a 10% increase and a change from 1.3 to 0.43%, are mathematically accurate. But one sounds catastrophic and one sounds marginal. The difference is the choice to present relative risk rather than absolute risk. Most health journalism defaults to relative risk because it is a larger number and produces more compelling headlines. The resulting public perception of risk is routinely inflated beyond what the data actually shows. A researcher at Adelaide University who co-directs an international forum on alcohol research makes this point clearly. Most moderate wine risk communications stem from relative risk inflation and from lumping all drinkers together, not from the biological effects of a single small glass consumed with food. Many everyday behaviors carry far greater metabolic or injury risks. This brings us to the more practically important comparison. What are the other things on the average person's table or in their daily routine that carry higher absolute health risks than a moderate glass of wine? Ultra-processed food is the clearest example. Ultra-processed foods, which include packaged snacks, commercially prepared meats, instant foods, sugary cereals, and most fast food, are one of the most consistently studied and most clearly harmful categories in nutrition research. A medical director specializing in early detection of cardiac and pulmonary disease makes the connection specific. Even a single daily serving of ultra-processed food measurably increases C-reactive protein, the primary blood marker of systemic inflammation. Consistent daily consumption suppresses satiety hormones, drives excess calorie intake, and is a direct driver of obesity and the metabolic conditions associated with it. Eating processed foods consistently for years compounds the damage in ways that research on moderate alcohol consumption simply does not show at equivalent drinking levels. Bacon, specifically, is a useful example because it holds a classification almost nobody discusses. The World Health Organization classifies processed meats, including bacon, as Group 1 carcinogens, the same category as asbestos and tobacco. Wine and alcohol are also classified as Group 1. But the absolute risk difference between a strip of bacon and a glass of wine matters enormously when making practical dietary decisions. A researcher who has studied alcohol risk extensively argues that a bacon sandwich increases cancer and cardiometabolic risk more than one daily glass of wine. The same classifications, different magnitudes. Seasoned ultra-processed chips represent another comparison. Regular consumption is linked to spikes in blood sugar from refined starch, LDL oxidation from industrial seed oils, and chronic inflammation. A bariatric surgeon who works with patients managing obesity and metabolic disease states that regular chip consumption produces more metabolic and inflammatory harm than a daily glass of wine, and that high consumption of ultra-processed snacks shows a stronger association with depression risk than moderate wine consumption does. Granola bars and other products marketed as health foods deserve specific mention because they exploit exactly the cognitive bias that makes ultra-processed foods so dangerous. Nobody believes a hot dog is a health food, but products labeled with words like protein-packed, high-fiber, natural, or organic create an impression of healthfulness that often obscures their actual contents. Many commercial granola bars contain 12 to 20 grams of added sugar and produce a glycemic response similar to a cookie. The marketing creates complacency that prevents the same skepticism people apply to obviously junk food. Commercially prepared salad dressings with industrial seed oils, added sugars and stabilizers poured over an otherwise healthy salad represent a similar dynamic. Social media is the non-food comparison that rounds out this picture. Heavy daily social media use, defined as 2 or more hours per day, has strong correlations with increased anxiety, depression, and body dissatisfaction in research. The absolute effect sizes associated with heavy social media use are substantially larger than those associated with moderate alcohol consumption. The average adult spends 2.5 hours on social media daily. The health cost of that habit, measured in mental health outcomes, is almost never discussed with the same alarm applied to a glass of wine. To be clear about what this does and does not argue, wine is not risk-free. Alcohol at any level carries some risk, and alcohol consumption above moderate levels carries risks that increase substantially with intake. Moderate consumption means up to 1 drink per day for women and up to 2 per day for men. For people with specific health conditions, family histories, or who are pregnant, abstinence is the appropriate guidance. The cancer link, though often overstated in absolute terms for moderate drinkers, is real. What this context does argue is that the cultural and media tendency to single out a moderate glass of wine as a significant health threat, while treating daily ultra-processed food consumption, processed meat intake, and excessive social media use as unremarkable, reflects a distorted risk landscape that does not serve people trying to make informed decisions about their actual health priorities. The things on your table that are most likely harming your health over a lifetime are probably not the wine. They are the ultra-processed foods sitting alongside it. New videos every day covering the health science that gives you the full picture rather than the alarming headline. Subscribe and stay with us. The relative versus absolute risk distinction is worth internalizing as a general tool for evaluating health claims, not just in the context of wine. Whenever you see a health headline claiming that X increases the risk of Y by some percentage, the first question to ask is what the baseline risk is. A 50% increase in the risk of a condition that affects 1 in 10,000 people produces a risk of 1.5 in 10,000, which is clinically negligible for most people. The same percentage increase applied to a condition that affects 1 in 5 people is an entirely different matter. Health journalism is rarely equipped or incentivized to provide that baseline context. Alarming statistics drive clicks in ways that nuanced probability explanations do not. The result is a reading public that is often more afraid of statistically minor risks that generate dramatic headlines than of large and consistent risks that have become normalized because they are familiar. Ultra-processed food consumption is the clearest example of this distortion. It is arguably the largest modifiable dietary risk factor for chronic disease in the developed world, affecting the majority of daily calorie intake for many people. And it generates a fraction of the alarm that a glass of wine does, despite carrying documented risks that are larger, more consistently established, and more directly causal. The attention economy shapes health culture in ways that make this asymmetry difficult to correct, but important to recognize.